Let's talk about eczema. Eczema is something we think about happening to little kids, and it does happen very commonly to little kids. Then they go through puberty, their skin thickens, they get oilier, and their skin barrier gets a little bit stronger, and the eczema improves, and then we start to age. And when we start to age, our skin gets thinner, it gets less oily, and then the eczema starts to show up again. So people can tolerate all these products when they're in their 20s, but then when they're in their 30s and 40s, all of a sudden those products irritate their skin. And that is a really common story. And this is the reason why, as you age, you have to be really careful about what you're putting on your skin if you have a history of eczema. So ideally, your skin barrier is intact, and you can use my vitamin C day treatment. You can use my bakuchiol glycolic acid based night treatment, and my face wash and my moisturizer, and everything's going great. Then you get stressed out, you do something, you eat a food you're allergic to, and your eczema flares, and you get sort of irritated eyelid skin or a patch of redness on your cheek. The second that happens, you stop the treatment. No day treatment, no night treatment. You just go back to the basic essentials. You wash your face with a gentle cleanser, a supportive face cream, and you use zinc-based sunscreen, and that's all you do. And you just do that every single day until your skin has calmed down. And once that happens, then yeah, you can add back in the actives. But so often we actually cause the flares in our skin because we're using products that don't agree with us. So when you're looking at products, particularly if you have sensitive skin, you want to avoid things that have common allergens in them. What does that mean? Well, number one is fragrance. Number two is essential oils. Number three for me is lanolin. It is actually the allergen of the year this year. And with people who have eczema, in a study, 66% of kids with eczema actually were reacting to lanolin in the most recent study. So it's not a benign ingredient. If you aren't sure, test. Try things on your arm. See if you can tolerate it there before you put it on your face. But know that our skin evolved in this world where it had very few ingredients it had to work with. And now we're putting on 6, 7, 8 different products every day, each of which having 30 to 70 ingredients in that. That just makes your skin have so much to process. And it's quite likely that at least one, if not several of those ingredients are going to irritate your skin. And there's actually a study done looking at the rise of clean beauty and plant-based beauty. And what's happened is as that rise has happened and more products are using plant-based ingredients, the allergic reactions to skincare products is actually going up. So even though Cetaphil is petroleum-based and is not biodegradable, it's not going to irritate your skin. Well, a lot of the plant-based products have ingredients that are going to irritate your skin. Where Dr. Rogers is special is that we are plant-based biodegradable, but every ingredient is still hypoallergenic because I don't want to be part of the problem. I only want to be part of the solution. You don't have to use my products, but you do need to educate yourself about what ingredients don't agree with your skin and try to use as few products as possible to minimize your risk of having an irritation or a flare of your eczema because of the beauty products you're choosing to use. Let me know if you have questions. Just send us a DM or put them below so we can answer them for everyone. Thank you.